morning and welcome, parents and family of BUSM MD Class of 2024. Thank you so much for joining us, and we're so excited to welcome your students today, August 3rd, 2020. I'm Suzanne Maselli. I'm the Associate Dean of Development at the BU School of Medicine. Before we begin, I would like to go through a few quick housekeeping notes. This presentation is being recorded and will be available on demand. Please submit any questions that you have in the Q&A box at the bottom of your Zoom screen. They will be addressed after we hear from our three speakers. And you will be directed to the white coat ceremony at 11 a.m. after this webinar. First, I would like to introduce our Associate Dean for Student Affairs, Dr. Angela Jackson. Dr. Jackson does need to get right back to our first-year students, so she will respond to your questions in the coming days. And now, welcome, Dr. Jackson.
Good morning and welcome to all of you. First of all, congratulations. We are so delighted to have your student join us here at BUSM, and congratulations to you for this great accomplishment. I met with them earlier and I'm looking forward to working with them over the next 4 years. And as Suzanne said, I'll be popping right out and getting back to the student activities. Let me tell you briefly what we do in the Office of Student Affairs. My office oversees all of the major components that aren't curricular, all of those pieces that go into making a physician. So we oversee student activities. We have over 80 student activity groups. And while COVID has presented some challenges, we're working hard with students to come up with creative ways to allow them to continue to engage in their activities in volunteering, in career exploration activities and such. We also lead the career exploration and career development curriculum, and we start that in year 1, and it goes all the way to match, residency selection, and beyond. The other major component of what we do in student affairs is to organize and oversee our advising program. We call it the Network of Advisors. All of the first-year students, when they arrive here at BUSM, are assigned to an advisor who is also someone who's going to help them learn the clinical skills. But we recognize that it's not a one-size-fits-all. And as students progress and mature over the course of their 4 years here, they'll have different needs. So students all have their core advisor, their AME. Additionally, we have a peer advising program. So students are paired with second and fourth year students to show them that end of the rope. They will develop additional interests in specific careers, and as they progress into third year, they'll select a field-specific advisor, an expert in their field, in addition to being assigned to a dean in the Office of Student Affairs from the get-go in year 1. Our main goal is to be here to support your students. We are in the office when we are in the office, and we're not virtual all the time, but even virtual, we're sure to have our continued program of open office hours. So every day there's a dean available for the student who just wants to drop in. Students can make appointments with any of us at any point. Additionally, there is a dean on duty, which is a dean in student affairs who is covering for student emergencies on the off hours, evenings and weekends and holidays. Additionally, housed within the Office of Student Affairs is our Academic Enhancement Office. I view the role of student affairs as being focused on student well-being, and we take student well-being very broadly, and that includes social well-being, academic well-being, and everything in between. So our Academic Enhancement Office has 2 full-time learning specialists who help the students strategize and identify their ideal learning strategies. Again, we're all about open office hours, we're all about the open door policy. And one of our major focuses during this COVID time is to make sure that we continue to be accessible to students, even though we're not physically in the office, both virtually as well as phone calls, emails, etc. We're here for your students, and we've created some opportunities, frequent town hall meetings, book clubs, small group discussion groups, to continue to make those connections and foster relationships. I do a walk and talk with the students. When I'm on campus, we go walking around the South End and answer any question that they might have for about an hour with small groups at a time. And I've done Zoom walks in the COVID time, and so we continue to be available. I have to say, I have the best job ever, and that is working with these wonderful students. And I want to thank you for the opportunity to send them to us. And I really look forward to the next 4 years. As Suzanne said, I'm going to jump off to rejoin the students, but I'm available if anyone has any questions, and I'm certainly available to your students. It's always ask them, they can ask me, and we're here for them for the full 4 years. And I look forward to that process. So nice to meet you all, and take care.
Thank you so much, Dr. Jackson. And now it is my pleasure to introduce our Associate Dean for Medical Education, Dr. Priya Garg. Dr. Garg.
Thank you, Suzanne. If you'll just give me a moment, I'm going to share my screen with all of you. I thought I would share a few slides to give you some visuals of the curriculum. So congratulations, as Dean Jackson said, we're so pleased to have your children and family members joining our class. I'm Priya Garg. I'm the Associate Dean of Medical Education. My role in my office is really to oversee curriculum and assessment and make sure that your children and family members at the end of 4 years reach the competence that we would expect for a student to enter into residency. I am a pediatrician by training, and so development is something that I think quite a bit, and I think in the education role it's similar, that we're trying to put your students really on a developmental trajectory that has them prepared for the next phase of education. So in terms of medical education, I wanted to explain that there are really 3 major pillars that we think about when we design education for medical students. The first is basic science. So throughout the first 2 years, and then emphasize in the 3rd and 4th, we're really preparing students for the basic science, foundational science fundamentals that are needed to diagnose patients and think about how disease processes are occurring in patients. And so in the first 2 years, the students will be part of 2 major foundational courses, PRISM and DRX. In those 2 courses, they will begin with biochemistry, anatomy, physiology, and then move into the 2nd year of pathophysiology. From the beginning, we also focus on clinical science. So you'll see this in the curriculum as something called doctoring. This is the course that really is preparing students to be able to communicate with patients, perform the physical exam, clinically reason through patients. And we start that from the beginning, where we want them to be working with patients, both real, standardized, and actors, so they're ready for that skill when they enter into the clinical phase. The 3rd pillar is health system science. This is really where we're teaching students about healthcare systems. We're teaching them about quality improvement, about how healthcare is financed, how hospital systems work, and are preparing them for all of the pieces of healthcare that they need to learn about before they enter into independent practice. And the other piece that exists throughout the curriculum is our focus on health equity. We are an institution where our mission is really focused on health equity, both at the university and at the medical center. And so throughout the curriculum, students will have cases that integrate concepts such as social determinants of health, structural racism, how to care for vulnerable populations, how to think about poverty, and so that they are thinking about patients in the context of who they are beyond just the disease. This is a schematic of our curriculum, which you may have seen on our website, but I did want to show this to you. And this box at the top is really the first year curriculum. So students are participating in 4 major courses that occur in the first year. The first is the foundational science course, which I discussed, which is called PRISM. You'll see it's made up of different modules. What we mean by modules are they're the different components of the course that are focused on different systems. So everything from molecular science, genetics, all the way to cardiovascular system, renal system. A second major course they take is called Human Behavior in Medicine. It's really a course focused on thinking about your own behaviors as an individual and how that impacts the way you interact with patients. So it's a course where students will explore their own implicit biases, where they'll think about development of patients from childhood to geriatrics, and really start to think about that intersection and the change from being a layperson into actually developing into a physician. The third course is Doctoring 1, which was called Introduction to Clinical Medicine. In that course is the one I described, where it's the doctoring skills of communication, physical exam, and clinical reasoning. And then the fourth course is called Essentials of Public Health, which is a course focused on thinking about public health and the role of physicians in public health. And then finally, the clinical phase will occur in the third year, and this is a schematic which you'll learn much more about as your students enter that phase, but really where students are traveling through the different core clerkships and determining what they want to go into. I did want to take a brief moment just to talk about COVID, since that has obviously impacted medical education in a way that we hadn't envisioned, but really has been an opportunity for us to innovate and think quite a bit about the way we deliver education. What I want to make clear is that our #1 goal is to maintain the safety of all of our students. In a letter that I wrote to your students, I did share some of the precautions and protocols we're taking to think about the safety of your students. All of the students in our doctoring courses where they will be working with patients or performing physical examination and learning are going to be in medical PPE. So we will be providing all of the students with medical PPE that will be needed, including face masks, face shields, gowns, gloves, and all of this is in line with the same things we are using in the ambulatory and hospital setting with patients. We also are quite flexible and able to adapt and innovate. I wanted to make that clear as well, that if the pandemic has a resurgence, if there are changes that we need to make because of we're concerned about safety, then we will adapt. We will use telehealth as we did with many of our clinical students. We will think of ways that we can deliver the objectives to your students and progress them. And so that is a really important part of what we do. We do need to provide students with hands-on training. And I want to make that clear that medical school cannot be purely remote. It's not possible to teach students how to develop clinical skills that are essential for patient care by being remote. And so we are requiring students to come in. The first hands-on required experiences will start at the end of August. And when they do that, they will be in PPE, as I explained before. The virtual curricula can fulfill some of the objectives, but not all of them that are required for medical school. We are open to any communication and feedback from your students, from our faculty, and from all of you. We are a program that focuses on continuous improvement, and so we are always looking for feedback from the students and their experience. And the last is that we think it's essential that students develop skills on teamwork and really learn how to make personal connections with both patients and their faculty. And that's another reason that it's essential that we bring them together as quickly as we can to ensure that they develop the skills of teamwork that's necessary to be a physician. I'm really looking forward to working with your students. I got to meet them this morning, and I think we are excited to begin a new journey in medical education with all of your family members. Thank you.
Thank you so much, Dr. Garg. And now I would like to introduce our 18th Dean of the BU School of Medicine and our Medical Campus Provost, Dr. Karen Antman. Dr. Antman joined Boston University in 2005, and under her leadership, the School of Medicine has grown and prospered. Dr. Antman.
Thank you, Suzanne. I'd like to welcome all of the parents to the BU Medical School family, where your son or daughter will spend the next 4 years, and the MD PhD students even longer. I'm a medical oncologist and the parent of 2 young physicians, and I hope that you enjoy watching the transition of your student to a physician as much as we did. Boston's a very diverse city of about 700,000, of whom 1/3 are students. The city's biggest employers are universities and hospitals, meds and eds. Thus your student will fit right in on both counts. Boston University was chartered in 1869, and from the beginning, BU accepted both genders, all races and religions, and had an international program. And other universities didn't adopt these important values until the 1970s or later. BU has a number of faculty and alums with Nobel Prizes and MacArthur Genius Awards. Alexander Graham Bell discovered the telephone while he was on the faculty, and Martin Luther King studied here for his doctorate. Dr. Shimomura, our own physiology professor, won the 2008 Nobel Prize for green fluorescent protein. The medical school started in 1848, and Boston City Hospital was built adjacent to the medical school in 1860. So we've been here in exactly the same place for about 170 years. The faculty and students today remain committed to education, research, and caring for very diverse urban, rural, and global communities. I'd like to make a couple of points. First, the obvious, we want to keep our community safe. We expect everyone on campus to follow the state of Massachusetts and the university COVID guidelines. Wearing a mask and social distancing are not political here on the medical campus, it's public health. We happen to have a Republican governor who was previously Harvard Pilgrim Health Plan CEO, so he's health savvy and has established very reasonable safety standards for the state. Your student may not be in a high-risk group, but some of their classmates, faculty, and staff certainly are. We're all in this together, and we want to keep them and our community safe and our campus open. For our medical students, today begins a major life transition. They're going to need your support, particularly in January and February. They're going to be working very hard. New medical students have always been the smartest students in their high school and college classes. Now, by definition, 2/3 of them will not even be in the top third of the class. That's a psychological blow. Nationally, medical students get discouraged with constant studying, and the shorter winter days will give some seasonal affective disorder. You're going to need your emotional support and your care packages to help them get through the challenges of winter. By March, days are getting longer and they can literally see the end of the tunnel, the light at the end of the tunnel. It's not a coincidence that medical schools have, each medical school pretty much in the country has an annual dinner dance event in February. If they think they're getting behind, make sure they ask for help. The upper class students love to tutor, and the ratio of faculty to students is 2 to 1. We hope that all of you will become part of the School of Medicine family. We have many events in all areas of the country. You'll get invited to receptions for alumni, students, and families in Boston, New York, Chicago, Los Angeles, San Francisco, Florida over the years. Hopefully we'll be able to have them in person, maybe by spring. We keep a parents' website so you can follow the curriculum, and we'd be happy to send you the school's magazine, BU Medicine. To make sure that you receive the information in the mail, just fill out your name and address information for our dean's offices, and we'll be happy to send out this information. And would really love you to enjoy the white coat ceremony and the reception. Be happy to answer any questions.
Thank you so much, Dean Atman. We are now ready to take questions. Once again, please enter them in the Q&A box. And there is one to get us started, which I'll address to both of you. But I think, Dean Atman, you might take it. What is the protocol for students who may test positive for COVID?
With the first, if they're not symptomatic with the first test, the university will get a second test because there could be a false positive. They and their roommate will be quarantined until the second test becomes available. If the second test is positive, they'll be expected to quarantine, and we'll watch them carefully for symptoms. We sign students up for primary care physicians as part of orientation. And so the intent would be that they would have physicians ready in the event that they actually develop symptoms.
So I don't actually see any other questions, which surprises me. If you have any questions, please do. Okay, there we go. When will the students get fit tested for PPE, and will they be given information as to where to replace the soiled masks?
This is Priya's.
So the N95 mask fit testing will happen on the third weekend that they are here when they do their BLS training. We do not anticipate that the students will need to wear N95s for any of the doctoring skills. We are not putting students in any aerosolized procedures of any kind or any high-risk procedures as we define them that we would use at the medical center. So they will traditionally be wearing surgical masks for the majority of the skills and settings they'll be in, but they will be fit tested like all of the students are during their BLS training. In terms of the next question, which I'm happy to answer, will will students work with cadavers? So our students, we think dissection is actually an essential part of the anatomy course and is a key objective for our students. And so they will be working with the cadavers. The students will be wearing PPE when they're working with cadavers. We've reduced the group sizes. They will be wearing, again, full medical PPE when they're in that setting. There also will be a virtual component that we have added so that the time in the dissection lab has been reduced this year, which will complement the dissection.
We have maybe for Dean Atman, can you address campus safety and security? It's in a rough area. Thank you.
The campus safety group will be meeting with the students, particularly those at the MSR, and will be going over procedures for safety. Students can request a walk home from the security desk at any time. We certainly discourage people walking around by themselves after midnight. And therefore we want the students to actually get a walk home. It's actually safer right now to be walking home than it is to be in a car. So we also have closed the library while it's still daylight because we do want the students home before, so that we don't have to put them in a car to get them home.
And we're going back to protocols. What about off-campus students? How will the protocols apply?
If it's close by, the security will walk them. I can't remember how many blocks, but after that, they'll have to take a cab or whatever, or walk.
I think that might have applied to the COVID protocols. I'm not sure.
The COVID protocols apply for whether you live in residential housing or you live off campus. All students, when they enter, will be required to do 2 negative tests for COVID testing. And then after that, because first-year students are in close proximity to residential students, they will probably test every week. And that's the current protocol that we have from the university. In terms of how often are family and friends encouraged to visit, this is my personal opinion. I think the students need their family and friends, of course, through this really challenging time. We would never apply restrictions to that, but what the university is saying is that if you enter onto the campus or any of the campus buildings, we will need people to be tested. So that will be different from in the past. Dean Antman, I don't know if you want to say anything about that.
Your students should have gotten a letter that gives them the directions for the first 2 tests this week and next week. As the students are moving into the student residence or moving into housing, we're getting them tested as quickly as possible. The testing center is right in the building. We get 24-hour turnaround time so that in the event that somebody's positive, we can move fairly quickly.
We're being asked if local students, Mass residents, will be able to visit home if they choose.
We are following state quarantine guidelines. So as long as students are following the state quarantine guidelines and are within the New England states, they can come back and forth without any prolonged quarantine.
Just a caveat on that. Keep in mind that these guidelines change, and we basically stay right up with them. The university is totally committed to following the state guidelines. But they do change, and as they change, we'll change. And so your student will get notification about the changes, and we will keep up with whatever the current CDC and Massachusetts guidelines are.
Will their temperatures be checked daily before entering the school?
No,
actually, that doesn't happen at the hospital. There's a series of questions.
Yeah, so every student every day receives a series of questions that are symptom screening, and that goes directly to Student Health Services. If they screen positive for any of the questions, and Student Health Services reaches out to the student.
For testing.
And do you anticipate allowing students to travel out of state during the Thanksgiving holiday week?
The university is encouraging students who travel out of state for a holiday. Basically, it almost doesn't matter where you are because it depends on where your relatives came from. To come back, not to come back, and to take the remaining couple of weeks online. That's an issue for medical students because so much of it is physical exam and that sort of thing. But nevertheless, we will certainly reconsider that as we get closer to Thanksgiving. But the idea is that we would prefer students not to come back if they go home for Thanksgiving. Besides, by the time you get through the 2-week staying in place, that the semester is almost over.
And what are the demographics of the incoming class?
Very diverse.
We'll hear that in a moment at White Coat. The
Very good.
Commission shares that.
They'll go over those. They basically like to tell the freshman class who they are, and you'll see that the statistics are quite diverse from many different states.
So stay tuned for the white coat ceremony. I think we have time for one more question, which is what measures do you have in place to enforce wearing masks? And what measures might you take for those who refuse to wear masks?
People who don't wear masks are not welcome on campus. The students really do have to collaborate with us for this because shame is probably one of the best things that we can use to get people to do the right thing. Furthermore, this is public health, so this is professionalism. If you're going into medicine and you don't follow CDC and state guidelines, we've got a problem.
I think you might have covered contact tracing. Are you doing?
Yes, if there's a positive, there's contact tracing. There's no point in getting a 24-hour turnaround time if you can't actually do that and put people in quarantine.
This may be covered during the white coat ceremony, but a question about the residency matching program. Do all students get a match, and what happens if they don't? And perhaps I should address that to Dr. Jackson after the fact.
For the past several years, we've had every student who went into the match get a match. Some students, because they want to get very competitive residencies, if they don't match in that particular residency, will choose to stay for another year, take a year of research, and then rematch. And a few students actually don't go into the match and take up careers in journalism, Wall Street, MD, JDs, that sort of thing, or business. So they don't actually go into the match, and obviously then they don't match.
And I don't want us to miss the start of the ceremony, but maybe one last question. When are students living in residence going to be permitted to interact with one another, given that test results may come at different times?
They're supposed to be quarantined. Well, if they're from Massachusetts or the several states that have low prevalence right now, they're supposed to be, they do not have to quarantine, but if they come from other states, they should be quarantining in their rooms except for getting tested. The first test.
So I don't want anyone to miss the start of the webinar. We will respond to your questions, any that come in now that we haven't been able to get to. You will be directed to a link at the conclusion of this webinar to the white coat ceremony, but if for some reason you need the link, it's in your chat box right now. I would like to once again thank our speakers, Dr. Antman, Dr. Garg, and Dr. Jackson, and give all of you a very warm welcome. We are so happy to be welcoming your students to the BU School of Medicine class of 2024. Thank you all.